can't keep my hands to myself.
The Impact of Hand Nerve Disorders Scale is designed for adults ages 18 to 60 who have experienced traumatic, compression, or peripheral nerve injuries to the hand. Individuals in this population often seek treatment through surgery or rehabilitation. The scale is a 32-item self-report questionnaire that evaluates an individual's current abilities and the effectiveness of said treatment. It can be used as a routine evaluation in the rehabilitation process and promotes client-centeredness as the patient's experience of their injury is taken into account. The scale can be used as a complementary tool in conjunction with other impairment scores. The questions rate the individual's perception of their injury through physical, emotional, and daily occupations. The I-HaND can be downloaded through the University of East Anglia's website. In order to receive a copy of the scale, a form must be completed with some personal information and the purpose of use.
Hi, Joe. How are you?
Good, and you?
Good. I'm Chantal. I'm the occupational therapist here, and I hear you were having some trouble with your hand. Is that correct?
Yeah, it was my right hand.
Yeah. And so the purpose of today, with your consent, would be to go through the Impact Hand Nerve Disorder Scale. And so basically what that is a 32-item questionnaire, and you'll be rating it on a scale of 1 to 5. So if that's okay with you, then we can get started.
Wait, that sounds good to me.
Okay. But actually just before, I would like to talk to you a little bit about how the injury occurred and how long ago that was.
Hey, I think it was about 2 months ago. I was just playing hockey, skating on the ice, and got tripped, and I fell out of my hand, and I could tell something wasn't right. So I went to the hospital and got checked, and the doctor said I had something called a distal radius fracture. Mm-hmm. So yeah, I'd definitely like to get back to playing hockey again. I mean, I've been playing since I was 5, pretty well every week, so it's definitely something I want to do.
Okay, and so before the injury, how often were you playing?
I was playing about twice a week, I'd say.
Okay, and so that's something that you really do find meaningful,
yeah,
and you really enjoy doing it?
For sure, yeah.
Okay, and so how has your job as a mechanic been impacted?
Well, I mean, every day I'm using both hands to grip tools and different things, so it's virtually impossible to kind of do the job with just one hand. Mm-hmm. So I'd say basically the strength and the pain is the biggest issue right now.
Okay, and so you're not working right now, is that correct?
No, and it's also really affecting how I dress myself and my daughter.
Okay.
So, I mean, it'd be nice to get something figured out.
Yeah, for sure. And so this questionnaire would be talking about your daily activities and how those are impacted. So if you're ready, then we can get started.
Okay, that sounds good.
The test was designed to be simple and easy to administer. With some intention of ease for the clinician, it can be self-administered and completed using paper and pen to answer questions based on a 5-point Likert scale. The test is laid out in a very clear format that walks the client through a series of questions in 4 parts to provide the practitioner with a global sense of the impact the hand nerve injury is having on their client. Part 1 is meant to gather information about physical and emotional implications of the injury. Part 2 asks about pain and discomfort. Part 3 about the impact the injury has on their daily routine by outlining specific activities. And the 4th part focuses on participation and relates to work and recreation. The simplicity of the test is also meant to encourage follow-up from patients as they are able to easily complete the scale from home.
So we're going to get started with part 1 of this questionnaire. And so I might ask you about some questions that you might not have had the chance to do yet, or that you don't do in general, but I want you to try to estimate what that would be like. So to get started with number 1, in general over the past week, rating it 1 very well to 5 very poorly, how well did your hands work?
I'd probably say around 4.
Okay. And over the past week, how satisfied are you with the following? So 1 being very satisfied and 5 being very dissatisfied.
Right.
The movement of your hands?
Definitely a 5.
Okay. The sense of touch in your hands?
I have no issue, so 1.
Okay. And the strength in your hands?
Probably a 5 again. Yeah.
And please indicate how often you have experienced the following in the past week, 1 being never and 5 being always. I can't grip or pinch for very long without my hand getting tired.
Always, so 5.
When I touch certain things, it causes pins and needles or tingling.
No, never, so 1.
When I go to pick something up, it falls out of my hand.
Probably around a 4. Doesn't happen every time, but.
Okay. And please indicate how often you have experienced the following in the past week. So 1 being never and 5 being always. Using my hands can bring about strong emotions, for example, frustration, anger, or sadness.
Probably about a 4.
I feel self-conscious if people look at my hands.
A 1. Doesn't bother me.
Okay. And in general, over the past week, this is leading into part 2, 1 being none and 5 being very severe, the pain or discomfort in my hands has been?
Probably about a 3.
And in general, over the past week, 1 being never and 5 being always, how often would you say that your pain or discomfort impacts on your daily routine?
Quite a bit, so probably like a 4.
And please indicate how often you have experienced the following in the past week. So 1 being never, 5 being always. I have hurt my hand and not realized it until later.
Probably a 1. Never really happens.
My hand feels oversensitive when touched.
Probably another 1.
Okay. And please indicate how often you've experienced the following in the past week. Never being 1 and 5 being always. I feel pain or discomfort when my hand is cold.
I'd probably say never.
Okay. It is difficult to get a good night's sleep because of the pain or discomfort in my hand.
Probably about a 4. It happens quite a bit.
And that is the end of part 2.
When thinking about the theories involved in developing the Impact of Hand Nerve Disorders Scale, or the I-HaND scale, we can take a peek into the Occupational Therapy filing cabinet, as this test seems to be mainly based on the physical determinants of occupation. As peripheral nerve injuries and hand injuries are both conditions that could cause impairments of the physical determinants of occupation, the questions in Part 1 and 2 of the I-HaND scale gather information from the client about sensory function, endurance, strength, as well as pain and discomfort to give an OT information about how their client's performance of occupation might be altered due to their physical injury. Furthermore, Part 1 of the I-HaND scale also taps into the psychological, emotional determinants of occupation, as a person's thoughts and feelings are factors that affect their occupations and how they do them. To quote Mark Thomas Ashwood, the author of the thesis article for the I-HaND test, it was not envisaged that psychological screening would be an aim. However, this test was developed through grounded theory, meaning that qualitative data was gathered from many participants to generate a new theory from the results, and throughout the study it became apparent that expressing and describing the emotional and social aspects involved with hand nerve injuries were very important to the clients when completing the test. Psychological and emotional factors could also be a primary health disorder, as depression and mood disorders could co-occur with a hand injury, or they could be a secondary factor, as a hand nerve injury could affect self-esteem, self-efficacy, or self-perceptions of the client. The client's answers to the questions 8 and 9 in Part 1 can help the OT understand the effect the client's injury is having on their occupations. The questions in the test also hit all of the points in the PEO model and most of the CMOP-E as well. Part 1 and 2 ask questions that cover the person category, as they dive into how the hand nerve injury is affecting the patient physically or physiologically by asking about pinching, grip strength, pain, discomfort, as well as emotionally and psychologically by asking about self-consciousness, frustration, and anger.
Okay, so to get started with part 3, in general over the past week, 1 being very well and 5 being very poorly, how well have you been able to carry out your daily routine? So for example, getting ready in the morning, cooking, or childcare.
I've been able to do a lot of things, but struggling with a few things, so I'd probably say around a 4.
Okay. Over the past week, how difficult has it been for you to complete the following activities? So 1 is not at all difficult, and 5 is unable. Getting dressed or undressed?
I'd say about a 2.
Doing up buttons?
That's pretty hard. I'd say a 4, because I'm still able to.
Putting toothpaste on a toothbrush?
can manage, I'd probably say like a 2.
Cutting your nails?
Haven't done it, but I'd probably say around a 3.
Okay. Cutting food using a knife and fork together?
Probably a 3 again.
Opening lids of tight jars and bottles?
That'd be more like a 4.
Pouring from a kettle?
Probably say a 1. It's not too bad.
Wringing out a cloth?
Probably around a 4.
Preparing a meal?
It's pretty hard. I'd say probably another 4.
Opening and closing heavy doors?
Well, I can use my other hand, so probably like a 1.
Okay, and thinking about your injured hand though, this is really, would it be difficult?
Yeah, I don't even think I'd be able to, so probably like a 5.
Okay, and so that's just something to be mindful going forward, just thinking about the injured hand.
Okay.
Turning pages of a book, magazine, or newspaper?
Probably about a 3.
Using electronic devices, so for example, a remote control, mobile phone, tablet, or computer?
It's pretty hard, but I'm still able to. Probably like a 4.
Okay. Carrying a heavy shopping bag?
I'm not able to, so a 5.
Handling small coins, so for example, a quarter or a dime?
It's not too bad, but still a bit of trouble, so probably like a 2.
Okay. And part 4, in general, over the past week, 1 being very well and 5 being very poorly, how well have you been able to manage the physical demands of your daily work?
I haven't been able to, so 5.
Okay. How well have you been able to take part in recreational activities, so for example, hobbies or sports?
Well, for hockey, I haven't been able to, so I'd say a 5 there too.
Okay. And so this is the end of the questionnaire, and so I'm going to tally up the score and then we'll talk about your results.
Right, perfect, thanks.
The International Classification of Functioning, Disability, and Health, or the ICF, is stated by the authors as the conceptual framework behind the I-HaND test, as it looks at how hand nerve injuries are impacting a person's body structure and function and their activities and participation. The questions in Part 3 help the occupational therapist gather information to paint a picture of to what extent their client's hand nerve injury is affecting their activities, mainly those of daily living occupations. The questions in Part 4 are more global questions to inform the occupational therapist of how the client's participation is affected and the impact their hand nerve injury has on the occupations that they choose to engage in. Turning back to the PEO and CMOP-E models, Part 3 and 4 cover the occupation category, as it asks for ratings related to very specific activities that are involved in the person's daily routine, such as self-care activities, like doing up buttons and holding a toothbrush, recreational and leisure activities, as well as productivity and work occupations.
For scoring of the I-HaND scale, you must add the raw scores ranging from 1 to 5 of all completed items and divide by the number of completed items to derive an average. The raw score can be converted to a percentage from 0 to 100% by using the following formula. In Joe's case, he completed all 32 items for a total score of 91. When dividing 91 by 32, followed by subtracting 1, we get 1.84, which we then multiply by 25 to get a percentage of 46%. Which would be Joe's official I-HaND score.
Okay, Joe, so from your results, today you scored a 46%. And so what this means is on a scale from 0 to 100, so 0 being no problem at all with your hands, to 100% being completely unable to use your hand at all, you're 46, so you're somewhere in the middle here. So from the questionnaire, I can see that getting dressed is something that you have a lot of difficulty with, in particular with doing up your buttons. And so that's kind of like a little precise movement. And then in regards to meal prep, it seems that you do have difficulty as well, just with cutting and like handling the knives. And that this is something that's meaningful to you because you need to be able to cook for yourself and for your daughter. The questionnaire doesn't cover your ability to shower or dressing your daughter in particular, so that's something that I'm kind of wondering about.
Yeah, I'd say showering hasn't really been much of an issue. I mean, I can manage, but more so with my daughter, I've been having issues like lifting her and like dressing her. So that's definitely a pretty prominent issue, I'd say.
Yeah. And I see that you're unable to work due to the physical demands specifically that require your hand with some strength and manipulating objects. So that's particularly an area that we saw. And in regards to grocery shopping, I know you mentioned that you can use your other hand, the non-injured hand, to carry a heavy grocery bag, but that if you were to use the injured hand, it would be a problem for you.
Yeah. For sure.
And that you're still able to carry it out, but you've adapted really with your injury. And that also from the questionnaire, you're unable to partake in your hobbies. And so from our discussion, that would be identified as partaking in hockey in particular, and that's something that is very meaningful to you.
Yeah.
And so that overall, you still do have quite an impairment in regards to getting able to work every day, and that's something that you identified as being really important to you, and as well as hockey and with your daughter. And so moving forward in regards to your treatment, I'd be discussing your results today with your healthcare team, so our interprofessional team, and then we'll be talking about a treatment plan moving forward. And then once we implement that together, I would like to reassess and see how you're feeling about your treatment and if there's been any progressions. Right. So that would be in probably a couple months,
right.
If that sounds okay with you.
Yeah, that sounds good.
Okay, awesome.
Thanks.
Several months later.
Hi, Joe. I know it's been a few months since I saw you last. I was just wondering how you're doing.
Doing pretty good, actually. I got out to hockey last week once, but my hand felt all right. A bit of pain, but it hasn't been too bad. And I started working part-time. So yeah, it's definitely recovering. It's not 100%, but I'd say it's definitely been improving.
Yeah, that's awesome. I'm really happy to hear that. And so if it's okay with you, we're actually going to go through the I-HaND scale again today.
Okay.
Yeah?
Okay.
Okay, Joe. So today you scored a 15%. And so this is a big improvement from the last time that we were here and you scored a 46. So that was about a few months ago. So we're happy to see some of those positive results. And still what you have left to work on is some of the mobility that you were saying with your hands and your physical, just being able to grasp the tools at work that you identified. And so we're going to continue to monitor your progress and work towards the goals that we created together of you dressing yourself and your daughter independently and getting back to work full-time as opposed to just part-time right now, and then participating in hockey about twice a week. Does that sound correct?
Yeah, that sounds good. It's really awesome to see that I've been making some progress.
Yeah, we're happy to hear that.
Advantages. According to an article by Ashwood et al., it is suggested that there is high test-retest reliability and internal consistency, as well as construct validity. Incorporates questions around self-care, productivity, and leisure, all in relation to occupation. Includes person factors, low cost, easily administered, quick to use, effective in tracking progress pre and post intervention. Limitations. Tasks on the scale may not apply to all clients. Self-reported. Clarity of questions. Limited research on psychometric properties of the I-HaND. Results do not determine severity of injury.
Theories and interpretation of results. Psycho-emotional. The client's affect during the questionnaire may influence his subjective responses. Understanding this theory will help the therapist to interpret the client's thoughts and feelings about their injury. Biomechanical. Based on a client's scores, we can compare their function to biomechanical norms, such as strength and range of motion. This will help us to determine what limitations the client may have. Overall summary. The I-HaND scale is used as a patient-reported outcome measure for nerve trauma, as well as nerve compression injuries that affect the hand. The I-HaND is free and consists of 32 questions based on self-care, productivity, and leisure that takes about 5 to 7 minutes to complete. Once completed, a score is obtained. However, it is necessary to explore scores of individual questions to get a better understanding of the user's functioning. The I-HaND is a new assessment tool that has been suggested to have good psychometric properties. However, there is limited research to support these findings.
The I-HaND scale is recommended to be used in primary healthcare settings, post-surgery, or throughout the rehab process. We recommend OTs use this tool in hand nerve injury patients to enhance client-centered practice by taking into account the patient's lived experiences and collaborate in their treatment plan. Although caution must be taken as it is a new assessment that has not been validated by other studies.